Medial epicondylitis, better known as golfer's elbow, is not only found in golfers, but anyone that does repetitive arm and especially wrist flexion motions. The wrist flexor muscles originate on the inside part of the elbow, cross the wrist joint, and form into tendons of the fingers. Icing should be done multiple times a day at the muscle's origin until the pain is completely gone. An ice pack for 15 to 20 minutes is recommended. To warm up, perform gentle range of motion of the wrist. Extend the wrist, then take it back to the neutral for 10 times. Next, follow this with a full wrist and finger extension stretch. Make sure to keep the elbow fully extended. Each stretch should be held for 15 to 20 seconds and done multiple times a day. Another way to do the same type of stretch is to use a wall. Again, elbow straight and wrist extended. Try both with your fingers up and down. Once the pain has decreased, you may begin strengthening exercises. Start with eccentric or the negative contraction of the muscle only. Support the elbow and forearm on your thigh or a table with your palm up. Flex the wrist fully. Once fully flexed, place a weight in your involved hand, then lower the weight down. Remove the weight and return your wrist to neutral. Build up to 3 sets of 10 repetitions. The same type of exercise may be done with a stretchy band. Again, make sure to focus on doing the negative or lengthening contraction of the muscle only. Remember to build up to 3 sets of 10 repetitions. If your pain increases, you may be doing too much too soon. A flex bar is another tool that may be used to perform eccentric contraction exercises. Hold the bar firmly in both hands. Twist the non-affected side backward while stabilizing the affected side. Now slowly allow the affected side to rotate backwards. Remember, only rotate back to the starting point with the non-affected side. Build up to 3 sets of 10 repetitions. If you're feeling little to no pain with the previous eccentric exercise, you may move to doing both concentric and eccentric muscle contractions. These may be done using a dumbbell or stretchy band. Build up to 3 sets of 10 repetitions. Massage may help as well. A gross rubbing of the muscle is okay, but is not as effective as a cross-friction massage shown here. Apply light to moderate pressure to begin and remember to massage across the muscle and not with it. A counter-pressure elbow strap may be helpful during activities. Secure the strap slightly below the elbow joint. Find the bony knot on the inside of the elbow and place the strap just below that. Don't allow the strap to fall down on the larger part of the muscle belly. Since medial epicondylitis can be aggravated by over-gripping, all objects that you grip firmly should be modified. Use athletic tape or any other self-adhering wraps to make the modifications. The goal with wrapping is to increase the circumference of the handle of the object that you're gripping, thus not allowing you to over-grip and strain the muscles. So we can continue to make these free educational videos, please subscribe to our channel.